Thank you to the Steering and Policy Committee. Thank you, Chairwoman and Democratic Women's Caucus, and to our panelists today for this informative hearing. In particular, I want to talk about the impacts these cuts will have, as you've been talking about, on women. And I want to focus on one woman in my district in particular, Nancy. I met her last spring, and she works at home as a health worker in Salem, in my district. She earns a living by caring for her mother and aunt, who are both disabled and blind. Because Oregon is one of the many states that has expanded their Medicaid program, Nancy can earn a living by taking care of her mother and her aunt in their home instead of in a facility. However, because of the Republicans' steep cuts to Medicaid, the funding for Nancy's mother and aunt's care, which Nancy relies on for income, is now at terrible risk. So with Republicans' cuts to care, the ACA, Medicaid, Medicare, people like Nancy are going to face impossible choices. Will her mother and aunt remain at home receiving patchwork care from family members stretched thin, or will they end up in a more expensive care facility with strained, underpaid workforce that she probably won't be able to afford? Nancy's story is not unique. We're seeing this across the country. Millions of families and caregivers are going to have to face these impossible choices as a result of these Republicans' cruel cuts and short-sighted cuts to the ACA and Medicaid.